Hello, everybody. Welcome to another exciting episode. Tonight, we're going to be talking about retinitis pigmentosa. Dr. Andy Rosenfarb, and I am so excited to have you guys here. It's been a really long time since we've taken apart each individual condition. And tonight, we're going to be talking about the retinitis pigmentosa family, okay? So it's not just RP. We're going to be talking about conditions like Leber's, Ushers syndrome. We're going to be talking about a whole host, Stargardt's, rod cone dystrophy, cone rod dystrophy, all these conditions that are under the umbrella of retinitis pigmentosa. And we're going to take apart each individual one of them so you guys could better understand. Those of you guys who've been following me for a while know that we've talked about each individual condition. But tonight, I'm going to give you some brand new content, maybe stuff that you guys haven't heard about before, specifically when it comes to retinitis pigmentosa and Usher syndrome, Leber's, rod cone dystrophy, cone rod dystrophy, Stargardt's, macular dystrophy, all these neurodegenerative conditions that are under the umbrella of that family. There's going to be a lot of content tonight. So I'm going to try to stick to an hour and respect your guys' time. However, I don't want to miss any content. So if we go a little bit later and you guys need to log off, that's fine. My goal is just to make sure we get through this content so that you guys have a clear understanding of what your condition is, why conventional biomedicine has been so hung up in terms of finding I guess, cures or treatments or remedies. We're really going to pick apart RP and this whole family of conditions so you guys really understand a little bit better. Do me a favor. If you guys can hear and see and everything's good, just post in the comments. Let us know. Let Blaine and I know that we're doing okay here. And the other thing I'm going to ask is and also let us know where you're in from. We got a lot of people on the call this evening. We got over 100 people just on Zoom, and we got a lot of people on Facebook as well. If you can't watch this, you can't finish this because you have a call or you have an appointment, a couple of people email me, that's fine too. All of these courses and calls and conferences are going to be recorded and for your on-demand viewing. The other thing I wanted to say is please drop your questions in the Q&A section below here. Now, if you're watching this on replay, you can go to our Dr. Andy Rosenfarb's AccuVision community group, and you could type in your questions there. You could also email me questions, text me questions, DM me, whatever. Because I know some of you guys are a little bit private about your situations. You're not too comfortable about posting questions in a public forum. So please feel free to email me or reach out to me or my staff with any questions you have. But for tonight, absolutely, please load up your questions. I will get to them at the end. After I finish up, I'm going to drop in, if you guys could see down below, those of you guys on Zoom, I will look at those. I won't be looking tonight at the Facebook stream questions, but I will get to them either later this evening or tomorrow. So that's a little housekeeping for you guys. Okay, so let's get going with tonight's content on retinitis pigmentosa. Sorry, I got an itch here. So tonight is going to be a lot. There's going to be a lot of content. It's going to be a little bit spicy too. I get a little bit fired up sometimes. So I'm very passionate about this content I'm going to be talking about. I also get a little frustrated sometimes about some of the content or lack of information that's out there. So I want to share that with you guys. So if you guys see, I'm just going to bring this to you real and raw. So get ready, strap in. So again, we're going to talk about the conditions. And the one thing I want to talk to you guys about is, so let's start off like, what is retinitis pigmentosa? Okay. So we know that conventional biomedicine says it's a genetic condition. Generally, 1 in 4,000 people will be diagnosed with this. But there are so many still questions that we have to ask about this. And again, retinitis pigmentosa does include Usher's syndrome and the various types of that, Leber's, rod cone dystrophy, cone rod dystrophy, cystoid macular edema is very common, Stargardt's, And all these conditions are related conditions that are called often genetic. All right. So you ask your doctor, okay, I have RP, I have Stargardt's, I have Usher's syndrome. What's the cause? All right. And you're told the cause is genetics. It's partially true. The interesting thing is a lot of patients that I work with are first generation. And that means that there's nobody in the family that has RP or nobody known. I also have patients who and/or have done gene testing, as many of you guys have, and they haven't been able to find any specific genes that correlate with their case. So what that tells us is, for some cases, RP, or the expression of retinitis pigmentosa, Ushers, Stargardt's, rod cone dystrophy, Leber's, is going to be genetic, okay? But not all cases. And we're going to talk about why and what that looks like. So that's my challenge. My challenge to you starting off is to question the truth as to whether or not all RP diagnoses are genetic. I'm not so sure right now. The other thing we're going to talk about is, so why do you have like good vision when you're born or when you're a young kid or young adult, or even some people get RP in their 40s or 50s? Why? What triggers it? Why do some people get it so young? Why do some people get it so old? We're going to talk about that. And again, when I use RP, guys, just for the purposes of this session and this talk, I am referring to all of the conditions: Usher's, Leber's, rod cone dystrophy, cone rod dystrophy, Stargardt's, in all the different forms of this. So just wanted to clarify that. So we know it's a genetic condition, as far as what we're told for biomedical conditions and the diagnosis there. We know that for RP and Usher syndrome, we have the symptoms of progressive rod degeneration, neurodegeneration. And what that looks like, those of you guys who have it, is progressive night blindness. That means that people with RP don't really do well at night. Like their night vision isn't very good. And that also includes dim lit places, right? So they have a really hard time getting around at night, dark restaurants, movie theaters, nightclubs. Once it gets dusk, even like cloudy, hazy, overcast days, when there's not a lot of brightness going on or any room or environment where there's not a lot of light, people with RP and Usher syndrome are really going to have a hard time struggling. Again, why? Because the rod cells help with our dark light, what's called contrast vision. Okay. So it's really important to know that. They're also going to have problems with adaptation. Means like we go outside and it's really bright, then we go inside where it's more dim or not as bright. Most of us can change or adapt to that change of dim vision pretty fast, within a couple seconds usually. People with RP, it takes a lot longer, sometimes minutes, sometimes 30 minutes, sometimes even up to an hour. It really is a slow process of adaptation to light changes. We could also see things like flashes, right? A lot of our peers and people with Usher syndrome have a lot of flashes, and that indicates inflammation. Sometimes it's tugging on the vitreous, but any flashes or strobe light effects, those are usually a result of excessive inflammation, which is one of the things we're going to talk about with RP a little bit deeper. There's another phenomenon called visual snow. It almost looks like staticky, almost like you guys are, from the 70s and 80s. Remember we had the antenna TVs where the reception came in, it wasn't so good. It's a staticky lack of coherence of a clear signal to the visual cortex, so that those clear nerve impulses are not getting to the visual cortex. It's a disturbed signal. Okay. So that's what we call visual snow. We also look at contrast, right? So the contrast isn't good as the rod cells start to degenerate. So that means the grayscale isn't going to be as sharp. Color vision is going to be a bit of an issue as well. Specifically with people with retinitis pigmentosa, it's going to be the reds on greens. So that type of reds, greens, browns, purples, when those colors start to overlay, people with RP really have a hard time distinguishing those various shades. So we look for improvement with those. Eventually, the vision, again, we talked about we start to look at tunnel vision, right? That's another thing that happens with RP. So the vision it's usually okay in the central vision. It's usually pretty okay in the far peripheral vision. And as RP progressive, it moves outwards. So this far peripheral visual field closes, and then it tends to move inwards progressively to the point where we just have like a pinhole right there. So it's almost like if you're looking through, if you grab like, oh, say like an old paper towel roll or something like that and try to look through that, that's pretty much what somebody with retinitis pigmentosa is looking through, or Usher's syndrome. Eventually, the degeneration of the rod cells can affect the cone cells or the central vision. So we can see encroachment onto the central vision, and that's where people really start to lose their fine acuity, their ability to read and stuff like that. The other thing that happens, we'll talk about, is CME, cystoid macular edema, which is very common in people with retinitis pigmentosa, which is where we have fluid-filled cysts or edema that can, from the inflammation, that can fill up in the central vision and really cause more progressive vision loss. So not only now do we have the vision loss in the visual fields and the dark adaptation in night vision, but now the central vision, the macula, is being affected because the inflammation is causing little fluid-filled cysts to occur in the macula. And those of you guys, maybe you know you have it, maybe you don't. And the test that we do in clinic, or you'll do with your retinal specialist or ophthalmologist, is called an ocular coherence tomography. And that's the test that we use to check the levels to see if there's any cystoid macular edema. Again, that's another thing we treat, and that just adds a level of complexity. We know with Usher's syndrome, usually early on there is hearing loss that happens, and then usually later on, late childhood into teenage or early 20s, we'll start to see progressive vision loss, and of course that will be diagnostic of Usher's syndrome. So the other thing that happens too is with retinitis pigmentosa is you have this accumulation of ocular waste or pigmentation, right? When they take a picture of the back of the eye, you can see, when you look through the pupil and see the back of the eye, there's all this like purple, brown, black staining, right? And that is pigmentation that is just accumulating. The body can't break it down and get rid of it. So it's an ocular waste product. It's an accumulation of toxic buildup that causes or partially causes the progressive degeneration. And what happens is when the pigmentation sits around long enough, there is calcium in there. And what happens is the calcium starts to ossify, and it becomes what we call bone spicules. So once that the pigmentation hardens and it's sat there, and the inflammation is driving it, so it's really cooking the buildup in there, and the bone spicules will form, and that's when you usually have real problems, because you have little pieces of bone or calcium lodged in the retina, and that is pretty degenerative as well. The other thing that could happen with RP is we could see other eye issues that happen, right? Those of you guys who have RP know that that you can accelerate cataracts, right? Cataracts is something that comes on real early with our peers. A lot of other conditions we see, a lot of patients with RP that have macular degeneration. There's obviously things like myopia, presbyopia, which is focusing. Macular degeneration, glaucoma is very common. I have patients with diabetic retinopathy. Sometimes we have these overlaying conditions. We'll talk about why that happens as well. So that's the picture, all right? That you guys know. Again, I don't want to spend too much time on that, because those of you guys who have it, you know what you're dealing with. But this is more for people who are friends and family, or those of you guys, I have some students and other people who are interested in this. So that's the clinical presentation. What happens is you go to your doctor, you're having problems. Most people are, when they're kids, they're clumsy, or they're stepping over, walking into stuff because they can't see their lower visual field. Or in kids, a lot of the time, they're petrified of the dark. Why? Because dark is dark. Like when you turn the lights out and the kids go to bed, it's like black. It's not like most of us when we were kids and we could see shadows and stuff like that. So they get really, really afraid, because when you turn the lights out, like they can't see anything. Even if they have to go up and go to the bathroom, they'll call mom and dad often. So it's pretty scary. And a lot of parents, like, that kind of tips them off. Like, wow, my kid's like really, really freaks out in the dark. Again, so you go to the doctor, we get tested, the eye doctor, the retinal specialist. They're suspect of retinitis pigmentosa. Sometimes they'll do an electroretinograph to check the electrical output. They'll do visual fields and pictures of the back of the eye, and those will all be a diagnostic of RP. So now that we understand what RP is, let's talk about what happens. Like, why RP? What happens? Why has conventional biomedicine had such a hard time understanding what RP is? And guys, I spent so much time. I've been doing this 25 years. I've been in practice 25 years, working with eye patients from all around the world. We've had over 10,000 patients come from over 50 different countries over the past years. Not so recent because it's still during COVID time. But the reason, and I don't claim to be better. I don't claim to be smarter. I don't claim to be a know-it-all. But the reason I know more about RP, in my opinion, than a lot of the specialists is this. I ask a lot more questions. I look at blood work. I do really weird tests with my patients. I talk about their family history. I've really dove very, very deep with a lot of my patients, especially early on when I was starting off looking at RP and a lot of these neurodegenerative conditions. And I really had a deep desire to understand what was underlying these conditions. It wasn't that just people had genetics, right? I just didn't buy that. It was like, okay, what does that mean? Like, what does that mean? It's just genetic. Like, genetic could be diabetes, alcoholism, hypertension, heart disease, depression, anxiety. So many things can be like genetic, it's a genetic predisposition. And a lot of these other conditions can be managed. So why couldn't RP? It's like scratching my head trying to figure out, there's a lot of things I had to figure out. But one of the big things that's relevant to this conversation is what is this genetic idea, and why can't there be a treatment? Just because it's genetic, why does that preclude any treatment? So that led me to really understand it. And again, after years and years of deep diving, looking at blood work, doing all these weird tests that are non-conventional, talking to patients, talking about their family history, talking about their siblings, comorbidities, what happened, what triggered the onset, when did it start, what made it better, what made it worse, all these questions that I really wanted to ask. And I started to see some patterns, okay? The biggest pattern I started to see is this. And those of you guys who've worked with me or heard some of my talks on RP know what I'm about to say right now. It's my belief system, and you're not going to hear this from any RP specialist or ophthalmologist. Maybe they are starting to, but very few, if any, are going to talk about this. RP is, in most cases, I'm not going to say all because there are no such thing as absolutes, but the highest probability of the causality of retinitis pigmentosa is this. You ready? It's autoimmune, guys. Retinitis pigmentosa, Ushers syndrome, Leber's, rod cone dystrophy, cone rod dystrophy, Stargardt's, your cystoid macular edema is rooted in autoimmune pathology. Now, what is autoimmune? Autoimmune means that your body, your immune system, which is designed to attack foreign invaders, microbes, viruses, bacteria, fungal infections, yeast, anything that comes into the body, our immune system flags and attacks and kills it and gets rid of it, right? Any viruses, bacteria, fungal infections, anything like that. Our immune system is designed to handle that. Autoimmune means the body attacks itself. It screws up, it messes up, and it tags its own tissue as foreign invader, and it attacks it. Okay, we know this. Arthritis, rheumatoid arthritis, our hands start to break down. Crohn's, colitis, Hashimoto's, lupus, Sjogren's, multiple sclerosis, eczema, psoriasis, the list goes on, all right? So autoimmune disease, it means that the body is attacking its own tissue, all right? That's what you need to know. In this case, the immune system is most likely attacking your retinal cells, all right? With RP, Ushers syndrome, it's likely in Ushers syndrome that it's also attacking the auditory nerves. or the part of the brain, the temporal lobes and the parietal lobes, part of the brain that processes hearing. So that is most likely as well, that the hearing part is also part of the autoimmune process. With Stargardt's, the immune system attacks the cone cells. That's your central vision. In RP and Ushers and Leber's and rod cone dystrophy, the immune system attacks the rod cells. Okay? That's what's happening. Why? That's a great question. Conventional biomedicine does not have a very good treatment for autoimmune. We're going to talk about the autoimmune process in a minute. So let's back up for a minute. So your Western biomedical doctor, your physician, accepts the idea that your condition, your retinitis pigmentosa, Stargardt's, Leber's, Ushers, is in fact autoimmune. Okay. So the first thing they'd want to say is, how do you test and how do you confirm? Okay. We know that when we do blood work, we can check for TPO antibodies for thyroid. We can do anti-nuclear antibodies, which is in the blood chemistry that shows us that we have antibodies present. We can check for rheumatoid factors. We can check for Sjogren's. All right. We can check for certain antibodies in the blood that reflect that there are autoimmune conditions going on. The eyes, the retina, is part of the closed system of the brain, the central nervous system, the brain, the eye, and the spinal cord. All right. Our spine, our brain, our eyes are one nerve off the brain, right? So it's one closed system. The only way we can, the reason I'm saying that is so you understand we can't do blood tests and check for antibodies in the central nervous system, okay? Because we have what's called the blood-brain barrier and the blood-retinal barrier. That means that it's selectively permeable. Not a lot gets past the brain in the retinal barrier and the spinal segments, and a lot of microbes can't get in, they can't get out, all right? So that means we can't check peripheral blood levels or screen blood levels for those types of antibodies. So how would we check? So if there are two ways that I know of right now that we could check for this, okay? One is biopsy. That would mean you'd have to basically do a vitrectomy, go back, scrape some of the retina, which is not great, which is traumatic in and of itself, and then check the retina tissue for antibodies. Not a lot of people are lining up for that procedure. I can assure you this. The second way to check for antibodies within the closed system of the central nervous system is, for those of you guys in medicine would know, would be to do a spinal tap. Also something a lot of people might not be lining up for, okay? Those are the two ways that we can assess, we can get a tissue sample or to source to see if we can find antibodies. Now, if we were to even get those samples, there have to be labs that are actually testing for retinal antibodies, all right? Could be optic nerve antibodies as well. So that's another conversation, but it's very relevant to optic nerve issues as well. Some cases of glaucoma and optic nerve atrophy. So I just wanted to throw that in there. So again, testing for retinal antibodies, more specifically cone antibodies, rod antibodies. Guys, there's no lab doing this yet. Okay. So even if we collected the tissue samples, there are no labs testing for these types of antibodies. There was one lab out in Oregon who was doing it. I don't know if they're still doing it. They're getting a lot of resistance and a lot of flack. And quite frankly, because a lot of these conditions are quite rare and uncommon, they didn't have a lot of business, and not a lot of retinal specialists were sending them tissue samples and to be screened for antiretinal antibodies. So say for hypothetically, we did collect a sample, we were able to send it out to confirm a positive antibody for retinal antigen for retinal antibodies. Say it's confirmed, sample done, we confirmed it, great. We have a lab that now says we found that you have anti-retinal antibodies. Now what? From a conventional biomedical standpoint, if that was accepted, your doctors would probably put you on drugs like Humira and Remicade. All right. These are used for arthritis. They're used for Crohn's, colitis, really bad rheumatoid arthritis. They're used for autoimmune. What they do are they're called immune suppressant medications. They suppress the immune system so it's not so overactive in attacking your body, right? So the immune system won't be attacking the gut lining, it won't be attacking the joints, it won't be attacking the thyroid, so on and so forth. So the standard conventional biomedical treatment would be something like Humira, Remicade, maybe anti-inflammatories, and most certainly some form of steroids. All right, so that's the treatment for autoimmune conditions. Immune suppressants, steroids, anti-inflammatories. Guess what, guys? All three of those, highly, highly toxic to your eyes. Look up all of them. Don't take my word for it. You will see the side effects for all of those. We know steroids can jack up eye pressure, causing glaucoma, accelerate cataracts. We know that anti-inflammatories have an effect on, can have effect on the vision, the blood flow to the eye. And we also know that drugs like Humira, they're very strong medications and they have side effects. Again, if you want to do your research on that, but again, this is a hypothetical situation, and my belief system, if when conventional biomedicine, specifically ophthalmology and retinal specialists do, and they will at some point get on board with the idea that these conditions are autoimmune, they're probably going to be putting patients on Remicade. Which in my opinion is not a good idea. It's not an effective treatment for these conditions, and it's probably going to do more harm than good. All right. So that's it. So what we have left there is a pharmaceutical strategy that is just not going to work. Okay. So what do you do then? Glad you asked. Conventional treatment obviously is they're not even accepting the fact that's a possibility, and the treatment is not much better even if it was accepted. What is extremely effective, and you guys are we're gonna talk about this, how and why, is alternative medicine. All right, alternative medicine, talking about Chinese medicine, naturopathic medicine, functional medicine, Ayurvedic medicine, any of the non-conventional older traditional medicines have a 4,000 or more year history of managing these type of autoimmune conditions. Guys, autoimmune is not a new, it is more widespread now. We're going to talk about why in a minute, but autoimmune pathology is not new. It's been going around for a very long time. 4,000 years ago, the Chinese medical physicians have documented in detail the etiology, the diagnosis, and treatment strategies with acupuncture, Chinese herbs, diet therapy, Qigong exercises, how to manage these conditions, okay? So has functional naturopathic medicine, which is a little bit more modern, a couple hundred years old at least. But they too have had a much more successful rate, even recently in the last 25 years or so that functional medicine has become popularized. They have a much, much better understanding, in my opinion, of understanding and working with autoimmune patients. And I see, in addition to eye patients, I see all types of autoimmune patients. So let's talk a little bit about autoimmune now and what happens with autoimmune. So autoimmune disease, the expression of autoimmune pathology, is something that is what I call sets up from a perfect storm. And we were talking about earlier, why are you kind of just going along and you just get RP, or you get arthritis, or you get Hashimoto's, or you get Crohn's or colitis, right? Why do you just get this? Does it just like happen? Where does it come from? It's your genes. And if it's from your genes, why doesn't the expression start from day one? And what are the triggers that can cause or accelerate gene expression, which manifests these disease, right? And what are the things that prolong it or inhibit the gene expression? Okay, these are really important questions that aren't being talked about too much, which is why we're on this call and why we're talking about it now. It's really, really important you guys understand these things, okay? So this perfect storm has to happen inside the body. And this perfect storm will result in, again, the expression, whether it's genetic expression or first generation expression of a gene mutation that's going to cause these types of conditions, okay? So what happens with a perfect storm? We'll assume for all just for argument purposes, that you do have an RP gene or an Ushers gene or Lieber's gene or something like that. Stargardt's, let's just assume that you do have that gene, whether it's detected or not. What happens? What things occur that cause the trigger or that trigger the gene to start to express the disease pathology? Well, it's a combination. It's not one thing. This is a huge field called epigenetics. All right. Look it up. I've done some talks on this. I don't want to get into it right now. We can in the future, but I want to, again, keep this kind of tight. So epigenetics just talks about this. What are the environmental factors externally and internally that can trigger gene expression and mutation? Okay. There are factors inside our body and from the environment, again, that can trigger gene expression and or cause genetic mutations. Okay. We know that. GMOs, genetically modified organisms, right? That's in the food and the plants and the produce we eat. Messenger RNA. Some of you guys have gotten the COVID vaccine. That is a GMO. It's a form of a genetically mutated virus. So GMOs are everywhere, all right? In our body, we are human beings. We have a genetic code. We have DNA, we have RNA. So the gene expression can and will be mutated, right? It's called, in other terms, it's called evolution, right? We evolve, we change, we mutate. So genes will mutate from three main factors, all right? There's infinite, but for this conversation, we're going to talk about lifestyle factors, chemical toxicity, and infections, plus your genetics, your predisposition. That is your perfect storm that is going to activate this gene expression. Okay. So again, you have lifestyle, stressful lifestyle factors. All right. We'll talk about that in a second. Toxic chemicals, pollution, or microbial infections, virus, bacteria, fungal infections, yeast infections, so on and so forth. Okay, the immune system will alter, all right? Your immune system will alter. The immune system, again, will flip into an autoimmune process where the immune system becomes hyperactive, right? We know things like cancer or immune deficiency. We have weak immune systems where the body can't fight infections. Kids get sick all the time. We get things like cancer. That is a suppressed, weakened immune system. The hyperactive immune system is allergies and autoimmune pathology. And those of you guys who are dealing with allergies, that is an extension of autoimmune. Okay, so not a lot of people talk about that as well. But if you have allergies, it's very likely that there can be some level of autoimmune activity going on in your body. All right, because that too is a hyperactivity. Your body's perceiving a protein from another substance as being toxic or a threat, and it's not. Now in New Jersey, we're dealing with pollens from trees and grasses. It's spring. A lot of people itch eyes and nose. It's perceiving the proteins in the pollens as an attack. All right, so the immune system flares up. We get these cytokine reactions, and we get itchy, burning eyes, and we get histamine reactions. Okay, so we have, again, these pollutants, these toxins, these chemicals, processed foods, poor sleep, sedentary lifestyle, GMOs, vaccines to some degree, leaky gut, pregnancy, puberty, hormonal shifts, menopause, medications, emotional stress, electromagnetic stress from cell phones and computers, right? This electromagnetic stress that we've been dealing with has really, really had an impact on our health, right? We know it affects our eyes. Those of you guys have listened to my talks before. I talk a lot about the EMF, specifically the blue light, the UV1 and UV2 lights on our vision. So radiation has an impact on our body. That can cause genetic mutation, right? Radiation definitely has an effect on gene expression. So the viruses in these bacterial infections and all the lifestyle stressful factors, again, we talked about lifestyle, chemicals, toxins, infections, plus a genetic predisposition. These can trigger an autoimmune, not in everybody, but in some people, right? The expression is going to be different. The epigenetic stress factors for each person is going to be different. That's why they can't find the cause or the cure, because it's different for everybody. Everybody's cocktail of what caused or stimulated the gene expression is going to be different. Somebody could have had the flu. Somebody else could have had food allergies. Another person could have gone through puberty, hormonal shifts. Somebody else could have had a really traumatic episode. Maybe it was an abusive childhood or something like that. Maybe for somebody else, it was a vaccine that triggered the gene expression. So there's so much going on that we really have to look at. And again, it's not just that, it's internal emotional stress. So people have these like dramatic emotional episodes that we know as well can trigger gene expression and gene mutations. So where does that all leave us? So one of the things that I assert right now, and again, this is not like future is the future, we don't know what's going to happen, but right now, guys, the best we can do, and again, this is going to trigger some people, but please just take it at its face value and from my experience. Right now, as you guys know, we can't cure these diseases, and that's not what it's about because of what we just talked about. You have a genetic predisposition plus all these internal factors like maybe Lyme disease or even COVID now, and these lifestyle factors, these sedentary, these junk foods, these GMO foods, these pollutions in the air and environment and the water and everything, plus the medications people are on. Guys, there's so much stress on our bodies right now. We can't, it's just, we're not really in the ballpark of talking about cure right now. But what we are talking about is remission. All right. That is possible. And I can say with confidence because I've seen it in clinic with my patients, not everybody, because it's a lot going on, but I have without question seen RP, Ushers, Liebers, Stargardts, rod cone dystrophy, cone rod dystrophy. I have seen cases go into mission. For 5 years, 10 years, 15 years, even 20 years, I've been dealing with some patients and working with them. And I couldn't say that, guys. That's the value of having done this for so long now. Patients I've seen, and we see it just doesn't get better. And you know how many patients come back to me and they say their doc said, I have no idea. You should be getting worse. You know, your vision should be getting worse. It improved and it's holding. That's what I always tell. Our goal, what's my goal clinically for all of my patients is simply this: try to recover as much as we can. And that's based on cell dormancy and trying to wake and revive the cells, the retinal cells that are sleeping. Some are dead, but some are also dormant, to try to revive and get the oxygen and the nutrition and wake the nerve cells up so they can function again. Okay, that's the one part of it. Then once we've recovered as much as we can, which generally takes about 8 to 15 months, then we help you keep what you got. That's it. That's the best we can do. And those of you guys who've been studying and following gene therapy, stem cell therapy, whether it's the CRISPR or the stem cell injections, they all say the same thing. They're not claiming, they're very clear that they're not going to recover vision. They're only going to help slow the progress. Okay. We already know how to do that. We're using acupuncture, supplements, herbs, hyperbaric, all these other therapies that are getting it done. So I know a lot of people are waiting around for all those treatments, and they probably will, at some point come around. But in the meantime, you're losing vision. So once those cells die, they die. And then the next thing you guys are going to have to wait for, which I think is going to bypass stem cell and gene therapy, is biotechnology and nanotechnology. So people who've lost a lot of their vision, again, remember the brain is what sees the visual cortex. The retinas are just the satellite dishes that are the receivers that pick up photoreceptors. They pick up the light and send the signals to the brain, right? So if the brain can see, all we have to do is get the visual information to the back brain. And again, I'm getting ahead of myself, but that biotechnology is likely. Biotechnology is moving so fast. So the people who've lost all vision, I think in a couple of years, they're going to have chips or whatever. They're going to Bluetooth or however the implants. Look, guys, they already have prosthetics where people can move their arms just thinking about it. We're very, very close to activating the visual cortex and just getting something like the artificial retina, which is going to work. That I know is in the pipeline, and I'm very excited about that. But for now, we still back to our subject, which is really understanding the mechanism of action of what causes RP, which is rooted in this autoimmune condition. which is driven by these lifestyle, internal stress, and environmental factors that cause these conditions. All right. So that's really it. And I want you guys to really understand that. So again, in functional medicine, Chinese medicine, naturopathic medicine, we have tremendous tools that can help manage inflammation. So autoimmune causes inflammation, it causes oxidative stress, it causes hypoxia, reduced blood flow, and it causes the toxic accumulation that we see, the pigmentation buildup. So all these factors can be managed, not cured, not treated, but managed well with these integrative therapies: acupuncture, Chinese medicine, functional medicine, naturopathic medicine, Ayurvedic medicine, vitamins, supplements, Qigong, yoga, eye exercises. There's so much that can be done. So I really get aggravated, and you can hear it in my voice, when retinal specialists and eye doctors or researchers come out and say, there's no treatment for retinitis pigmentosa, Ushers, or Stargardt's, or any of these conditions. There's no treatment. Come on. No way. That's not true. BS. I call BS on that. Why? Because I know. I've seen it in clinic. Nobody on this planet or any other can convince me that these treatments that we do not have a positive effect. We've done research. I see improvement with patients every week. We test our patients, we do a treatment, then we retest. Is it going to work for everybody? Of course not. Is everybody going to have all this vision recovery? No. But we can get some vision back. We can help slow the progression. We can deal with the underlying cause because we know what's driving it. Okay? So the problem is that, for me, is that conventional biomedicine and the researchers are going around in a lot of these communities saying there's no treatment, don't bother, don't waste your time, yada, yada, yada. I call BS, because you don't know what you're talking about. With all due respect, I don't care how big your degree is, how you're the top RP specialist of whatever. If you're telling patients there's nothing available to them, shame on you. Seriously, be honest. Say there's no drug and there's no surgery available right now. That's all. I don't have anything to offer you. We don't understand the mechanism of this disease, but there might be something else. And guess what? There is. Okay. So this is not forcing. We don't push anybody to get treatment, but my stand here is for people who want to do something, who want to get treatment, who want to fight for their vision, right? Your vision is our mission. I'm very, very passionate about that. And I'm very serious about that. We are here for those of you who want to self-advocate for better vision, specifically in this case for retinitis pigmentosa, Ushers, Stargardt's, and the related RP family conditions. All right. If you want help, we have help. Guys, I was talking to Blaine earlier today. I am putting together an entire program for you guys on how to manage this autoimmune condition. It's going to take a lot of work and a lot of time, but I'm going to put together a training for you guys, for those who are interested, to have you guys come in, learn in a very deep dive as a patient. It's going to be video and live stream, so you don't have to come to New Jersey for this stuff. Or it's going to teach you what it is, what the autoimmune is that we just talked about, and what you can do. It's not one thing, and there's no like one thing that's just going to get rid of autoimmune. It's a systemic, and we're going to talk about that. But there are some nutrients that help, and we're going to talk about what you can do really quick. I want to give you some of that tonight, but I'm just letting you guys know that that's this year, that's coming. We're going to create these online programs to really help those of you guys who want to manage and really tackle this autoimmune situation, which is going to require some work, but you'll understand it and you will be in control, right? You will be in control. You will get results and it will help, guaranteed. The only guarantee of it not working is if you don't apply the strategies that we put you into, and that will be, of course, your own decision. So again, the problem is there is no conventional treatment for this situation, for RP, Ushers, Stargardt's, so on and so forth. There's no treatment. If you have CME, cystoid macular edema, maybe they'll give you laser therapy, maybe injections, but there's no treatment for RP. Vitamin A, retinal palmitate, omega-3 DHA, research, sometimes yes, some say no. So what's the possibility? It's what we just talked about. The possibility is you can do something about your vision, all right? Whether you believe it or not, like this is not a time to be like, I've already made up my mind, confuse me with my facts, unless that, if you've made up your mind and you don't want to do anything for your vision, I get it. I respect it. I honor that and I appreciate that and value that as your opinion. However, that is a lie, all right? Just say that you don't want to, you just want to wait for, stem cell gene therapy, that's fine. But please don't go around telling other people as well that there's nothing available, because of course there is. So it's possible to recover vision from RP, and it is possible to preserve long-term vision. How do I know? Again, I've treated thousands upon thousands of patients. We have tested, treated, tested our patients, and we've seen the measurable results. Everybody? Of course not. Nothing's going to work for everybody, but it is science. It is consistent. It is we can repeat the results that we get, as demonstrated in our studies with Johns Hopkins and Nova Southeastern. So what do you do? All right. We know Western biomedicine. Hang in there, guys. Keep following, follow the research, follow the stem cell research, the gene therapy, the CRISPR research, the biotechnology, the nanotechnology. It's coming. Definitely going to be there. I'm not saying, I'm not against any of that. In the meantime, while they're telling you there's nothing that can be done, do something. Take supplements, right? Functional medicine, again, naturopathic medicine. Naturopathic medicine, we're dealing with the autoimmune process. We're dealing with oxidative stress. We're dealing with circulation. We're dealing with inflammation. We're dealing with toxic accumulation, lymphatic congestion. When lymphatics aren't moving, you're not detoxing. Lymphatic drainage, one of the best things for CME. We're going to put a video together for that for you guys. Those of you guys with cystoid macular edema or CSR, we're going to show you specific lymphatic drainage techniques that have been shown to dramatically reduce the edema buildup. For those of you guys dealing with that, lymphatic drainage is huge. And if you guys want to, even go find somebody who does lymphatic drainage and start getting massage. It'll really help with the edema situation. Chinese medicine. In Chinese medicine, obviously we're dealing with acupuncture, Chinese herbs. Chinese medicine has a whole language. What we're dealing with primarily, those of you who are my students, and I know we have practitioners on here, we're primarily dealing with a pattern called lung deficiency, which means the immune system is hyperactive. In Chinese medicine, the lung deals with the immune system. So again, we're talking about that hyperactivity of the immune system. We're also talking about liver blood stasis. In Chinese medicine, those of you guys know, blood stasis means coagulation or accumulation of metabolic proteins, which is what we see when we dilate the eye and we look in the back of the eye, and then we see the pigmentation built up. Okay, so all these treatment modalities are designed to manage those specific diagnostics that we find consistently in the majority of our peers and Ushers cases. All right, so we also said that lifestyle is a huge factor, guys. So you have to manage stress. All my RP patients say this all the time. Every week I hear this, guys. Vision gets better when I'm working out and when I'm managing my stress. Vision gets worse when I stop exercising and I'm under more stress and I'm having more sedentary lifestyle. Guys, why is that? I'll tell you why. The retina is the highest oxygen consuming tissue in the whole body. It needs oxygen. How do we get oxygen to the retina? We move our body, circulate, exercise. When we exercise, we move our blood, we get more oxygen to the peripheral parts of our body. Peripheral, hands and feet and head, right? Exercising delivers all the blood flow to the heads and feet, increases peripheral blood flow. We need that, very important. Stress does the opposite, causes vasoconstriction, reduces blood flow to the periphery. People have cold hands, cold feet, reduces the blood flow to the heads, to your head as well, all right? Reduced blood flow, no bueno. Reduced blood flow, less oxygen, less food, less nutrients, less detoxification, less reduction of waste products, okay? So managing stress, diet. Guys, we talked a little bit earlier about allergies. Food allergies is critical. There's a couple companies. We use one called Alcat. There's Cyrex is another good one that I like. Check food allergies. Your food allergies are going to cause inflammatory processes that are going to activate immune system. We talked about signaling and throwing gas on the fire for these autoimmune processes. Foods that you're either inflammatory or sensitive, you have an immune-mediated response to, meaning real full-blown food allergies, are going to make your RP worse. It's just, that's the way it is, okay? So consider doing a food allergy testing. Also, an alkalizing diet, more greens, more vegetables. If you go on the internet, you can type in alkaline foods, mostly green leafy vegetables, and vegetarian type diet. Junk foods, more acidic. Vegetables and fats and whole grains are a little bit more alkaline. The other big factor you guys need to understand, which I'm going to get into when we start talking about our autoimmune module that we're going to be offering for you guys, is the role of the gut health. Your gut, it's called the gut microbiome. Guys, leaky gut syndrome, a weak structural gut, weak integrity of the gut lining called dysbiosis or leaky gut syndrome is one of the most critical driving factors of autoimmune expression. It doesn't mean it's the only thing that's going on, but it is a huge piece. So if your gut's a mess, you have food allergies, you have leaky gut syndrome, dysbiosis, you're constipated, you got the runs, you have all kinds of GI issues, we have to fix those. It's critical for managing your RP. All right. Talked about exercise. The other thing is blue light protection. Got to wear your glasses, your screens, your phones should be on night mode for blue light protection. Okay. When you're outside, UV1, UV2 protected light. So protect your eyes from screens, protect your eyes from UV light and sunlight. Okay. Take a swallow here. Talking so much, my throat gets dry. Okay, so supplements. Again, before I want to give some time for Q&A, so I'm dropping into some supplements here. Supplements for RP. There are quite a few. We know vitamin A, retinal palmitate. Those are very useful. These are your carotenoid antioxidants: lutein, zeaxanthin, astaxanthin, mesozeaxanthin, vitamin A, retinal palmitate. All very good for the eyes. Your leafy green vegetables, your yellow vegetables, fantastic. Want to take those. Also, omega-3 DHAs, fish oils, or any form of omega-3 DHAs. Got to have fats. Why? Fats regenerate nerve tissue. If they get sick, damaged, they need to heal and regenerate. Our retinal cells and photoreceptors are nerve cells. They run on blood sugar. They repair and regenerate from fat. And they need oxygen, okay? This is another reason we've been using hyperbaric oxygen with a lot of our treatments. Again, hyperbaric oxygen delivers oxygen to the retina, again, which is the highest oxygen-consuming tissue in the body. So that's why we're using a lot of hyperbaric. I get a lot of questions about that. The other big thing is CBD, all right? Cannabidiol, our product is called Canavision. Full spectrum is best. We recommend a minimum of 150 to 250 milligrams of full spectrum CBD daily. Now, if you're drug tested, the full spectrum has 0.03% of THC. It will show up in a test. So if you are being tested or you're concerned or you got kids or something like that, you want the no THC version, we have broad spectrum. Full spectrum THC, broad spectrum has no THC. Not quite as effective, but we'll still get the job done. Excuse me. Also, taurine is really useful. We have a whole host. For those of you guys who want to find out which supplements are best for RP, on our website, we have a whole list of conditions. We do all the conditions, and we have retinitis pigmentosa, Usher syndrome, Stargardt's, and we have the list of supplements that are recommended for that specific condition. That is found on eyehealthinstitute.com. Okay, that's our website where we sell our nutritional supplements. Is going to be eyehealthinstitute.com. All right, so if you're curious, you want to find more about which supplements specifically are for RP, you could check that out. It's free. There's no cost just to go to that website and check that out. So what do you do? Like, what are you going to do? What are your options right now? So you basically have two options. You could sit and wait for conventional biomedicine to come out with gene therapy, stem cell therapy, or something that's going to help RP. retinal bypass or whatever they come out with, or you can do something. It's a personal choice. You guys could do whatever you want. For those of you guys who are interested in taking some action, this is what I recommend. Start by getting educated. Sessions like this, right? You're getting information that you've never heard before, guaranteed. If this is your first time listening to me talk, you've never heard this information before. Go back to our YouTube page. Watch some of our patient education videos, all right? A lot of them talk about the processes, how we use acupuncture, how we use Chinese herbal medicine, functional medicine, naturopathic medicine, hyperbaric, low-level lasers for treatment, eye qigong exercise. We have videos for eye qigong that help increase the blood flow in the the photoreceptors in the eyes. So do that. You know, there's a lot of stuff you can do on your own. Go to Eye Health Institute, get educated on which supplements you might be taking. We have books. I have 6 published books on eye diseases. All right, 1 for RP. We have a 99-cent book on Amazon, acupuncture and retinitis pigmentosa. We also have Healing Your Eyes with Chinese Medicine. Those are lay books. Those cost money, but you know, you can get those to help you with your education and learn more. Do research online, you know, get yourself educated first, do your information gathering and find out what makes most sense for you. Then talk to somebody. You know, you could do a telehealth consultation with me, find a functional medicine practitioner, maybe somebody in Chinese medicine, acupuncture who has some training in this. Guys, it's really important if you're going to seek out a healthcare provider, alternative integrative healthcare provider that has, you know, that is going to help you with your vision. At least in Chinese medicine and acupuncture, they should have some level of expertise or advanced training in how to handle these conditions. If you are looking for a functional medicine practitioner or naturopathic, please make sure they are well-versed in autoimmune. All right. Just they should know how to do that, because they may not know that RP is autoimmune, but that's what you're kind of sniffing out for. So do your research, right? After you've compiled your research, then you may decide what course of action is best for you. All right. Do you want to do a consultation with me or somebody else? Maybe you're ready to jump all in. You want to try treatment. Great. Give us a call, email me, call our office. Again, email, text, call, you know, telepathies sometimes work, but reach out. I am very receptive to questions, inquiries. And guys, we don't accept all patients, right? We have a lot of patients who come in. The reason our success rate is so high and over 90% is because I'm very selective with who we choose and let into clinic in terms of accepting patients. If I don't think I can help you, I'm really busy. We're not going to accept patients. So a lot of patients right now are having problems with travel due to COVID. So we're doing a lot of telehealth consultations or emails and stuff like that. So that'd be something as well. Okay, so we're probably close to about an hour, and I really wanted to take some time to jump into some of your questions because I know you guys have a lot. So I'm going to get to as many questions as I can. And then if you guys have questions, again, please feel free to drop them in the comments. And if you're watching this on the Facebook Live, I will get to them later on, or you can email, call, however you want to get in touch with us. So first question I have, can retinitis pigmentosa cause inflammation in other parts of the body? Yes, joints, etc. Why? To answer that question, now you guys can answer that question yourself, because RP is a systemic autoimmune condition that's localizing in the eyes. Patients can have arthritis, Ushers syndrome, Crohn's, colitis, thyroid. Do you know how many of my RP patients have coexisting thyroid issues? They know it's hypothyroid, but guys, a lot of low thyroid issues are also Hashimoto's. They kind of flip-flop, right? So it's autoimmune conditions. Next question. Somebody asked if Brimonine is, it's an eye drop, right? That actually drop is used for glaucoma, and somebody's asking if it's effective for retinitis pigmentosa. So my answer to that would be no. That is actually a glaucoma eye drop that's used for dropping eye pressure, which again would be used for glaucoma, but I've never heard of an RP specialist using that as off-label. So my answer to that is no. If you have more on that, let me know. I'd be interested to find out. Is hyperbaric oxygen helpful for RP? Yes. Why? We just talked about that as well. Your retina is the highest oxygen consuming tissue in the body and need more oxygen, right? Oxygen deprivation due to systemic hypoxia or the congestion due to the buildup of pigmentation in the eye, the ocular waste product, can be blocking or obstructive to the flow of oxygen to the eye. So how much hyperbaric? We usually start patients with 20 to 40 hours of hyperbaric sessions. We have patients even flying in right now just to do hyperbarics. Unfortunately, hyperbaric is not super easy to find all the time. But we have patients coming now just doing hyperbarics, and some are doing, a lot of our patients now are doing a combination of treatments. So let me move on here to your questions, moving right along. Is ischemic optic neuropathy will be addressed? I will, that is for Mark, but not in this session. That's ischemia, so that's eye stroke. I will get to that at some point, Mark. So we will be doing a whole session. So be on the lookout from that probably next month on ischemia and eye stroke. Okay, that's called branch occlusions, central branch occlusion, or vein or artery occlusions. So stick with me. All these treatments are very effective. We're seeing a lot more patients over the last 2 years with these ischemias, especially with hyperbarics. Let's get to the next question. We'd like to know if diet and RP, gluten, dairy, sugar. Yes. So with that, we talked about gluten sensitivities and food allergies. Guys, I strongly recommend you get food allergy testing. It is very, very, very important. Okay. Very, very important for managing your RP. Don't let that go. And guys, I'm not, this isn't a pitch here. Maybe it is, but we don't charge lab fees. So the lab fee to do most of these tests for a 200 or 250 panel is about $300 to $350. We don't charge our patients for that. All right. We just charge the lab fee. So if you go to somebody and they're like, hey, we're charging all this money and it's $700, $800, $900 just to run food allergy panels, we're happy to do it for you. Just send us an email. We'll get you in as a patient, and you can do food allergy testing through us. If you're an established patient. Another patient, Sherry, has wet macular degeneration. Again, just due to time, our next session in 2 weeks is going to be on wet macular degeneration, dry macular degeneration. We're going to go through macular degeneration. So I apologize. I'm just not going to get to that question right now because I want to keep it to RP patients. 2 weeks, we will be having a whole session on macular degeneration. So hang in on that. Is face blindness RP? No. So face blindness is central vision. Now, it can be RP or cone dystrophy. It's in the family, and it's also Stargardt's, which is also juvenile macular degeneration. So in the family, juvenile macular degeneration or cone rod dystrophy can be in this family. Macular degeneration also causes central vision loss, or they can't see people's faces or reading, which also can be an effect there. Moving right along. Choroidal neovascularization related to RP. Yes. Why would that happen? Again, neovascularization is because the retina doesn't have enough oxygen, and that's from Lou. The body will go through a process called angiogenesis, which is building new blood vessels to try to get more blood flow to the retina. All right. We improve the blood flow and use things like hyperbaric oxygen. It will no longer need to create these new blood vessels, no longer have a need for neovascularization. So acupuncture, our treatments, reducing inflammation, hyperbaric will all add to reducing choroidal neovascularization. Eye floaters. Yes, eye floaters from Steve. That is a consequence of it's mostly shedding of protein in skin. We use hyaluronic acid for that, but we have to deal with the oxidative stress, the immune system, the inflammation, the poor blood flow to the eye. Eye floaters are a consequence of these conditions, okay? So hyaluronic acid will help in capsule form, very useful, but we still have to deal with the underlying causes. Yes. There's a lot of, somebody's just talking about specific meds for autoimmune. There's a lot of different meds for autoimmune. They kind of manage it, but they have a whole host of autoimmune meds have a host of side effects. Does RP autoimmune have anything to do with the microbiome? Yes, we talked about that because it starts in the gut. Got to clean the gut up in order to help heal the autoimmune. That does not mean that cleaning the gut up will get rid of it. It is a huge piece in the autoimmune puzzle. We're going to go into a deep dive with that in our sessions. Give me a sec, guys. Wetting that whistle. Okay, what vitamins, minerals do we recommend? We talked about that. Again, guys, go to our Eye Health Institute and you guys could check out our recommendations for specific eye conditions there. If we get the vaccine of COVID, which one is recommended? With the COVID, I recommend go back. We did a whole 1 hour talk 2 weeks ago. Mick was asking this question. Go back. Look inside this Facebook group, and we had to take it off YouTube because YouTube got rid of our video. They flagged it and they took it down for whatever reason. But we do have it on Vimeo. We have it on our website, so you guys can check that out. Cataracts, absolutely. The product we use is called Can-C Eye Drops. That's what we use for our peers and everybody else who has early to mid-stage cataracts to help reduce those. Those are on our website as well. The Can-C Eye Drops are the best thing to help slow down that progression. COVID vaccine, again, go back and watch the video that we did last week. It'll give you all the information on how COVID, both the virus and the vaccine, may or may not impact your vision. A lot of good stuff you want to know about that. Is there benefit to UV blue light for the eyes, brains? Yeah, so a little bit of UV radiation is good. Too much UV radiation to the skin, we know causes skin cancer. Too much blue light to the eyes is damaging, right? Little UV radiation, not a problem. Little UV light, not a problem. Most of us are what? Sitting on our phones, looking at screens, too much blue light. Need to protect them eyes, guys. I have a talk, guys, go to our YouTube page called Cataracts and Carotenoids. That's the name of the talk that I gave that talks about the specific distinctions and use of blue light and UV light and how to protect your eyes. Specifically, the carotenoid antioxidants are what protect against the blue light and UV light, all right? Those are your insurance policy. Should all protect against the time. Protect blue light protection, UV light protection. Absolutely. Please make sure that you do take that into consideration. Sleep. Yes, sleep is huge. Thank you for bringing that up. I mentioned that earlier. Guys, you got to get your sleep. And Ambien, smoking weed and drinking a bottle of wine or having 5 shots of tequila is not sleep. You are passing out. Tylenol PM. Guys, once in a while, if you got to reset, fine to take meds. If you're dependent on sleep aids, you must regulate your sleep cycles. Sleep is what? This is when we repair and when we regenerate. Okay. Very, very, very important for recovery. Sleep. Try to be in bed by 11. Try to get at least 6 hours. Sometimes you need more. Sometimes you need less. Sleep is very, very important. Another question about the vaccine. Again, reference the video we did. Blue blockers. Yeah, we talked about blue light. Again, UV1, UV2 protected. Blue light glasses, $20. Get them on Amazon. Your glasses too. You can get the coating. Go to your opticians. They'll do that. I have a kid. What's the percentage of pathogenic? Totally. I would just get it checked. So I tell parents who have RP in the family, just watch their kids. Get them tested every year or so. Watch for clumsiness, afraid of the dark, stuff like that. Just monitor it if you know it's in the family. It's not definite. The gene pool is kind of like this, rolling the dice. You never know, as Forrest Gump says, you never know what you're going to get. Life is like a box of chocolate, right? Okay. More questions coming in. The 2-week program. Okay, yes. So our 2-week program, that is what we recommend for our new eye patients. Come in, do our vision testing. We have 2 treatments a day for 2 weeks, 20 treatments, then we retest. Acupuncture. For little kids, we do needle-free. We have our AccuVision Junior program, which is for no needles. We'll do things like alternating current stimulation, microcurrent, laser acupuncture, hyperbaric, acupressure, cupping, gua sha, all these different non-needle techniques. For adults, teens who can handle the needles, we do twice a day. We treat, again, after 20 treatments, 90% of the time we see a measurable improvement in vision testing. Once in a while, I get thrown for a curveball and we don't, but most of the time we do. So that is the generals on the treatment program. If you want more specifics on that, again, feel free to email me or call our office. Alcohol, yes, alcohol in moderation. Alcohol will definitely affect your vision. It's dehydrating and pro-inflammatory. Some people are more sensitive than others. Try to moderate it. Try not to have alcohol on an empty stomach or more than a couple drinks. It absolutely can accelerate RP. Carnosine, eye drops, yes, that is Can-C. We talked about that. Eye drops help with RP. So the eye drops we recommend specifically for RP, thanks for Semela, is MSM Eye Drops. So we also carry those on our Eye Health Institute website. What MSM does is it softens and breaks down the toxic accumulation. It's good for the ocular microbiome. We talked about the gut microbiome. This is the ocular microbiome. The ocular microbiome needs to be soft, squishy, and healthy. And the MSM Eye Drops basically help the body to break down the metabolic waste. It prevents the eventual progression of bone spicules in the eye. Very, very useful. We recommend pretty much all of our RP patients are using MSM Eye Drops. 10 RP, one out of 10 RP, how many success have we had? So for 9 out of 10 RP patients are going to show measurable improvement. And that means objective and or subjective. So that means we measure improvement and they report improvement, brightness, contrast, visual fields, reading, so on and so forth. We don't have another clinic right now. We are thinking about it, especially because of COVID. We know travel is a thing. So we are looking into the possibility. We are looking at Florida. We are looking at Dallas, Texas right now. Those are the two areas that I have in mind right now that we're looking. Possibly. We're eyeing Florida and we're eyeing Dallas. So we're going to talk about that later this year. But we are putting together these home therapies, and I'm not going to talk about it too much on this session because I'm getting ahead of myself, and but we'll talk about that. Thank you for asking. Ozone help. Great question. So another question from Smala. I went crazy with ozone about a decade ago, maybe even 15 years ago. Those were the studies out of Cuba. I was so excited. I thought it was going to be the greatest cure for RP. It didn't. That's the long and short of it. Oxygen, hyperbaric oxygen helps. Ozone, I found, did absolutely nothing. We tried everything. The insufflations, the IV, it didn't do it. So from experience, I dropped like 10,000 on ozone equipment, and it just didn't, it didn't work. So ozone, I'm a no-go on that. It just didn't work. Great for other things, but for eyes, definitely not. I just didn't see the improvement. Next question is, does vitamin E make RP worse? Now, here, this is kind of a loaded question. Kay Lewis asked me that. I don't think so in small doses. I know there was studies that went out, and I do not believe that in small, maybe large doses, but I think that in small doses, vitamin E is fine. I do not have an issue with patients taking small doses. Based on what I know about vitamin E and the tocopherols, I just don't think that it's damaging. Let's see. Somebody's asking about macular pucker, part of RP. Not necessarily. It's more of a macular degeneration issue, although I think I've seen 2 cases of RP with macular puckers, but that's usually a different issue. How is RP? Okay, so great question. Nicole asked a question. How is RP related to diabetic retinopathy? A lot of cases of diabetes are autoimmune, especially juvenile onset. Juvenile onset, diabetes a lot of time, or even adult onset. If it's not obesity, blood sugar, stuff like that, The body can create antibodies, like we talked about, for retina, joints, MS, that can also attack the pancreas. So you can have patients with, I have one I'm working with right now, who has RP and diabetes. It is rooted in the same autoimmune pathology. We got to watch that too, because diabetic retinopathy is a real thing. So we want to watch that. So it's an added level of complexity, but there are two branches coming from the same thing. Make sense? Thank you for asking that, Nicole. Okay. Is your food allergy testing a blood test? Yes. This is not a RAS test. It's not a skin test. Don't get those done. Don't, guys, again, with all due respect to allergy specialists, do not get food allergy testing done with your skin test. It doesn't work. It's a totally different thing. Please, please, please. Thank you for asking this question. When you're going to get blood test, when you're going to get your food allergy test, rather, please make sure it's serum. That means they draw blood and they run your blood against food allergies. How do you determine RP patients are able to drive? Okay, great question. RP, so it depends on state to state. You have to have 20/40 or better, correct your best corrected vision, or I believe 20 degrees or better of visual field. Again, that's going to vary from state to state. Let's see. We do strip to Australia. Like to see you. I have gluten-free allergy. Yeah, Donna, hit me up, DM me about that, or email. Problem with sleeping. Guys, if you have problem with sleeping anxiety, my selfish self-promotion of the Canavision. Guys, Canavision is amazing. It regulates the immune system, helps with inflammation, controls oxidative stress. That's why I created my own product. Canavision is my #1 right now for RP, Ushers, and all these conditions. It is the single most important nutrient next to omega-3 DHAs and carotenoid antioxidants that you can be taking right now. If you're going to take a minimal of a few things, omega-3 DHA, carotenoid antioxidants, and high potency CBD. If you're not going to do anything else, take those three. Can someone with RP handle pregnancy? Wait, can someone with RP? So that's really good too. So we mentioned earlier, again, I know we're going over. Thank you guys. I really want to get to your questions. So a lot of patients with RP who get pregnant have noticed that after they deliver, their vision gets worse. There's a lot of reasons for that. One is we talked about earlier, the epigenetic stress factors. Being pregnant has effects on your DNA. It can be a source of gene signaling and genetic mutations. There are tremendous, right, ladies, moms, tremendous stress on the body. Pregnancy is not for wimps. It's amazing how you guys do this. It causes tremendous amount of stress on the body. After you give birth, you're exhausted, you're staying up late, breastfeeding, just dealing with children is very, very stressful on the body. So all across the board puts a lot of stress. So we deal very, very exclusively and specifically with our pregnant women who also have RP. There are specific strategies that we work on to help mitigate any of the possible vision loss that can come with postpartum, from postpartum RPers. Where do we put the needles? Francis, great question. So most of our patients, most common question we get, needles do not go in the eyes. Thank you for asking that. It's the most obvious question. Most of the needles actually go in the hands and the feet, okay, and around the forehead. They don't go in the eyes, some in the back, some in the forehead, around the cheeks and the temples, hands and feet. I developed a system called Microacupuncture 48, which is a bunch of protocols and a system that we use to treat. I have some students that I've trained around the world, and those of you guys who are interested can reach out to me. Talk to you about that as well. Is RP the same as retinal detachment? No, RP is retinitis pigmentosa. Retinal detachment is when you have a detached retina, which is a whole other conversation that we're going to get into. But that was a question that was asked. So the answer to that is no. Thank you so much. Msm Eye Drops, not Can See for RP. Yeah, Msm Eye Drops for RP, Can See eye drops for eye fatigue and for cataracts. All right, Samala. Do you have a technician student taught? that is in the Midway area. Yes, we are in Dallas. My good friend, Carlos Chapa, Dr. Chapa, is seeing eye patients in the Midwest. We may actually make that a second satellite location soon. How often use Msm Eye Drops? Twice a day. 1 drop in each eye twice a day. Investigated light therapy. Yes. Red light therapy, I haven't seen the best results with, but low-level laser, not LED. We didn't see the best results with that, but low-level laser therapy we do in our office. I did a clinical research study, and it definitely helps for a lot of patients. Any new upcoming trials? No, but if you know anybody, I would love to. Always excited and always looking to get involved with research. So I have studies ready to go for any researchers that are looking. A couple more questions. What do you think about what medical medium says the body does not attack itself? I call BS. The body does. We have a thing called antibodies. We have autoimmune conditions. They are real. No. So here's the thing. Epstein-Barr, heavy metals, they will facilitate. Those are the triggers that can disrupt the immune system. So yes, I understand what they're saying, but they can be causative factors. So yes, you can have Epstein-Barr, you can have heavy metals, you can have Lyme disease. Those will screw up the immune system, cause it to dysregulate, and you'll have hyperactivity, and the body will kind of turn on itself. All right. So does the mutation for RP come from the mother's side? Yeah, it's not 100% sure where the mutation comes from. It's just, there's a lot of research. We're still checking it out. Most people say it's X-linked. Yes, I think there's a lot to that, but my honest response to that is we still need to do more research on that. Genetics is kind of a new field still. A lot of research still to do on that. But right now, yeah, they're saying a lot of it comes from X-linked type. I know I'm umming a lot here. I'm going through your questions. 2 more questions, and then we'll wrap it up. Do you have a book to learn about the techniques of how to acupuncture? Yes, we have 2 books, 3 books actually for clinicians. Healing Your Eyes with Chinese Medicine, the Microacupuncture 48 book, and Ophthalmology and Chinese Medicine. Those are all on the www.Eye Health Institute website. And last question for this evening from Regina. Hi, Regina. What do you think about the eat right for your blood type? I love it. So here's my thing with the eat right to your blood type. I found clinically, it works for me. I'm a type O. I do fantastic on the type O blood type. What I found clinically is not necessarily going to be relevant to RP, but it either totally works or it doesn't work. So I recommend you check it out. It's Diadamo's book. I'm a big fan of it, actually. It basically talks about specific diets for your blood type. And I am interested in learning more about RP and blood types. I haven't quite got there yet, but I'm very interested. I would love to see if any of you guys have research on that. Please let me know. I'd love to see if there is some correlation with certain types of RP. That's something I'm looking at as well. Okay, got through it in about 1 hour and 20. Guys, I really appreciate your time. This is a lot of new content. I know some of it might have triggered you a little bit. It conflicts a lot of what some of your doctors saying. I get it. A lot of your doctors are saying, oh, there's no treatment, yada, yada. Don't waste your money. Don't waste your time. Guys, advocate for yourself, right? Do what makes sense for you. If you want to check it out, you want to investigate this stuff, do it. You don't need your doctor's permission. You don't need your family's position. It's your eyes, right? That's it. It's your eyes, your life. Do what works for you. I am here to support all of you guys, family, friends, any of you guys who are dealing with eye conditions. Please reach out to us. If you're a practitioner, you're more interested in learning about training, how to help patients, either through naturopathic medicine, functional medicine, acupuncture, Chinese medicine, please reach out to me. We have online courses. If you have a practitioner that you think might be interested, have them reach out to me. We have trainings that we offer. I just really want to say thank you guys. I love doing these talks. I'm looking forward to doing our next talks in 2 weeks, which is going to be on macular degeneration. Thank you for your time. Thank you for your patience. And if you have any other questions, you want to hear more, please send us feedback too. What did you like? What didn't you like? We got some great feedback after the last session, and we're looking forward to more of these. Take care, guys. Have a great night. We'll see you soon. Please send us some questions and comments that you have. Bye-bye, everybody.